everyone. Welcome back to On Our Days Off. I am Jordana. This is a space where we are having conversations, making space, and figuring it out. Today we have a special guest back, Miss Audrey Lee, LMFT, also owner and creator of Alloy Center for Therapy. Welcome back.
Thank you. Thank you for having me.
Thank you for being here. The first time we had you on, I was like so nervous because it was you were our first guest and it was our first podcast. And then we went back and watched it. And my husband was like, you didn't even introduce her. And I was like, oh my God. I was like, I know. I was like, if you watch, keep watching. I introduced her halfway through.
First time, you learn as you go.
Yeah. So I said, this time I'm not going to forget.
Okay.
But last time we didn't really talk too much about you starting off. I wanted to kind of talk about your experience in the field first and how you got started, because I was reading something you had written and you were speaking about how you knew you wanted to be a therapist since you were, I think, 10 years old, you had said.
Yeah. How did I start off? Well, I think as I've gotten older and done more reflection, I realized that a lot of the reasons why people, including myself, go into this field is to fix their families, in some capacity. So I think knowing I wanted to be a clinician at 10 years old had a lot to do with like the role that I played in my family as the fixer, as the caretaker in some way. So I think that was always kind of like in me and bred in me. And I think kids can pick up on what's needed within the family really early on. So I think I assessed that subconsciously and kind of like went with that. It actually worked out for me. So
it seems like it did.
Right. But so yeah, I think it was always just really comfortable to be able to assess what people were feeling and be intuitive about like what was happening in the room and in the spaces that we weren't talking about. But like for instance, when you walk into a room and you can feel tension.
Yes,
right.
Definitely.
Very attuned to that. And I was very attuned to like watching and understanding what was happening that was creating that. So that was a big reason why. I think another reason was I struggle with my own depression. I don't know if we talked about this last time.
No, we didn't.
Okay, so I struggle with my own depression and around that age, and I never really felt like people understood how to move towards mental health. And so, it was a time in my life where I felt like I was, middle school is always like a really rough time. So,
oh, totally.
Middle school, not really understood, growing up in a, low income neighborhood where like, I didn't really fit in with the kids because I was kind of quirky and, I would come outside dressed like Clueless, like people from Clueless. And like, what the hell did she have?
Oh my gosh. That was definitely one of my movies growing up.
Yeah. And they're like, who? So I went to school with all white kids. I was one of the only Black kids, but I lived in a neighborhood where it was all Black. And so I was never white enough. I was never Black enough. I never felt like I fit into a space. So I was always kind of like on the outer fringes of group spaces. And so that was like a really, really low point. And I remember telling my mom, we talk about this now, but I remember telling my mom like I was depressed at that time. And she's just like, what? Like,
what does that even mean? You're in middle school.
Like you're in middle school, like you're fine, you'll be fine. And realizing that like once I started talking about it, that it was something that a lot of kids were going through. We all
I'm sorry. I'm sorry to interrupt you. You mean you started talking about that with your mom or other students?
other students, I would start talking about it with other peers, like that I was struggling, that I,
Okay.
having suicidal thoughts. And one of the things that happened in my school where it was predominantly white, was other kids were talking openly about that, not in my neighborhood, not with the Black kids. That mental health wasn't something that it was safe or comfortable enough to talk about, but we were talking about it. I was talking about it with my peers at school. And I realized that mental health was something that was the connector. We all were struggling. It didn't matter race, socioeconomic status, like you had two parents, you had one parent, whatever background you came from, we all were trying to figure it out. We all didn't understand ourselves. We all were struggling in some capacity. So um, at that point, I it was like a light bulb went off for me
Yeah.
around 10 or 11. And then preceding that time, my mom put me into therapy, and I had a wonderful experience with the therapist. So I'm like, oh, you can help people, you can talk to people, and you can, sit in a beautiful office and like, have this, and this is a career to just like talk. I'm like,
Right.
I could do that, so that kind of like drove me. I did an internship with a psychologist at like 13.
Wow.
And started just really owning that was what I wanted to do. And so, yeah, just I kept driving with that, and and on um, in every area, it would be confirmed that was something. Now, people would talk about like, wow, like, how did you know? How could you understand what was happening there? And my dad was pretty affirming around like believing that I had he would call it a gift, but an ability to be intuitive, and understand people and understand emotions and understand how to communicate to people about those things. So the affirmation, I think the great experience with a therapist for myself, me struggling with my own mental health, seeing it be pervasive in my family, it just kind of all came together and was like, there's something here. I could do some good work here.
That's awesome. That's great.
Yeah.
That's interesting because I wonder what happened with your mom because at first she went from like, you're a kid in middle school, like, what are you talking about? To then being like, I'm going to put you in therapy. How did she make that transition?
I think she always believed in therapy, but I think as a single mom at that time where she was taking care of her mom was sick and had Alzheimer's. She
Okay.
was, trying to just like keep her head above water. And this is part of the systemic issue within, a lot of Black communities is we don't really have time to focus on mental health.
Mm-hmm.
And so she was stressed the hell out. So it wasn't that she didn't necessarily believe in it. It was just like, this is another thing that I have to address when I have like a laundry list of things that are on my plate that I'm responsible for. So again, as an adult,
Right.
I've done reflection on like what was happening for her. I could see her as a woman now and
Right.
navigating life now, in my mid 30s. I'm like, yeah, life is challenging. So I think that was what was happening for her. She was stressed, she was overwhelmed, and didn't really feel like she had the energy or the resources to be able to tap in at that point.
Definitely. Definitely. Has she ever, if you're comfortable asking, has she ever had therapy herself, like before she had put you in it or after she put you in it?
Before, no, but
Okay.
after, yes, because I have been like adamant about anyone who is in my close circle or in my life and wants to sustain a relationship. I kind of not required, but like I strongly suggest it because I think it's like if you don't know what you don't know, you're spilling out everywhere, right?
Yeah.
And so my mom and I would have these moments where, like, I would talk about my boundaries, and she's like, what are you talking, like your boundaries, like or your anxiety, like, and so I'm like, you need to do some work to understand so we can communicate more effectively. And
Yeah.
I'm willing to do the work. So she has gone to therapy since, and it's been amazing to see the transformation and for herself, but then in our relationship too.
That's awesome. That's
Yeah.
great. And now here you are doing it. So how many years have you been doing it for now? Because I know I had read you've been doing it for over 10 years.
Yeah. So right after after undergrad, so 15 years.
Oh wow, that's a long time.
Mm-hmm.
Wonderful.
Yeah.
Congratulations.
Thank you. Thank you. Thank you.
I was like, I was talking to my husband about when we were trying to set up this episode. And I was like, the first episode, I was emailing you personally.
Yeah.
And then I said, I just emailed Audra and she hit me back talking about hit up my team. I was like, wow, things must be going pretty good over there at Alloy. I said, excuse me. So congratulations.
Thank you. Thank you. I'm trying. I'm
Yeah.
trying. It's not easy developing a team, but
Yeah.
it's fine.
Great.
Yeah.
So I wanted to kind of continue our discussion. The first time we had you on, we kind of talked about, reasons to seek therapy and just different aspects of therapy, if you're new to it. But this time I kind of wanted to talk more about, go into, you know, trauma, trying to heal from things that happened to you and all those different aspects. But I know that you are a trauma informed therapist. Is that important? Do most therapists, are they trauma informed? Is that something that you should look for specifically if you're going through crisis, or how's that work?
Uh, Not every therapist is trauma informed. And I think it really is based on your training
Okay.
and your belief system about how change happens. I believe that everyone has trauma, so like I hear, I'll have conversations with some of my colleagues and they'll say, like this client has trauma or this client didn't have trauma. And I'm like, what are you talking about? Because we all, if you have lived, long enough to be able to communicate and articulate words, typically,
Yeah.
you've dealt with some level of trauma. And when I think about trauma, I think about anything that has happened to you that has impacted you emotionally that stays with you, right?
Yes.
And so that could be anything. But what we do as a culture is we take the worst case scenario of trauma, the spectrum, we look
Mm-hmm.
at the end of it and we say that's trauma, which is like you're black, you're poor, your parents were on drugs. Oh, you poor traumatized person, right? Versus trauma looks different cross sectionally, but we all struggle with something. We all are impacted emotionally by something.
Right. I agree with that. It's you know, what it's interesting that you said that, because I want to ask you, what are some things that are trauma that probably most people don't even think about as trauma? Like they don't even consider it.
Totally. So I did a workshop called the pathology of privilege. And so that was really to start to highlight the ways that particularly white males fall through the cracks around being able to get mental health, and not to say, oh, white men are like these victims and like we need to feel sorry for them, but we need to understand that we dichotomize people and we say, if you're poor, and if you're a person of color, we recognize that that you have trauma, and there's an implication of pity. We pity you, you know, you need help, you need services, but starting to expand and understand that like trauma looks different in every particular race and socioeconomic status. I see a pathology pattern that happens with particularly white men because they are the standard, and what we don't think about is trauma incurring in their family. If they have like a parent who's wealthy, if they have, you know, parents who are successful, doctors, lawyers, and live this life that we think is like perfect, we don't even explore, to what you're asking me, something like emotional neglect. So that is what I would say is something that's traumatic that we don't ever think about. So if I come from a upper class, middle class, upper class family, and I'm white, and my parents have never hugged me, have never given me any sort of affection, have never affirmed me in any sort of way, it's absolutely trauma. And it's pervasive. And it creates a lot of attachment issues and inability for you to be able to empathize with other human beings. And so when I talk about like the pathology of privilege, a lot of times we have this lineage to, I mean, this direct correlation to white men and these mass shootings. But there's a correlation to like, I have never gotten my emotional needs met. No one ever even assumed that anything was wrong. And so there's a detachment from human life.
That's
Right.
interesting.
So that's absolutely traumatic. I see it all the time. I work with clients around it, and we have to name it because when I work with people who perceive themselves as being privileged or having some sort of privilege, when I ask them like, what has happened in your life, or how, you know, how was your childhood, or what, you know, what was traumatic for you? And they're like, oh, I have, my childhood was perfect. Next question. And I'm like, okay, let's go back, because perfect doesn't exist.
Right. They're saying it's perfect because from the outside looking in, they were well off because they had wealthy or whatever you consider to be successful parents.
Absolutely.
Okay.
They're considering themselves perfect because no one has ever told them or ever acknowledged the complexities of their pain.
Yeah. It goes back to what you said earlier, how everyone is experiencing something with mental health. How you said, well, your mom was too busy because she was a single mom in a poor, you know, low socioeconomic community,
right?
You know, where she was like, what are you even talking about with you're depressed in middle school? And then these white males who have wealthy and successful parents are kind of experiencing neglect as well.
Absolutely.
It's interesting.
Yeah.
What were the responses you got whenever you did this?
People.
First of all, who was your audience? Because this is interesting. I mean, who was your audience?
We would do trainings, diversity and inclusion trainings for different organizations. So like the library, we did diversity and inclusion trainings for the library. I did a couple one-on-one trainings for Duquesne University for their psychology program. So it would be different settings. I would say that like this particular thought process or a workshop where we would highlight this there would be at least one white male who would like raise their hand and refute, you know, or be curious or be reactive to the idea. Right. And so, but it was so funny because I will always preface the workshop with, this is going to create reactivity, particularly for white men. I would say that, and literally it was like they couldn't even hear it. Right after I said, they would raise their hand and say, excuse me, I have a question about this. And I was like, you don't say, because it's so it's one of those things that it's a new it's a concept that we're not really like openly talking about. So anything that's kind of new or not the status quo, people are like, wait, what? We have privilege. I mean, we have trauma. Like, no, that's not how I think about myself.
Right.
Right.
Right. And it probably is hard for people who've come from the same circumstance that you have to even hear that.
I agree.
They're probably like, what are you even talking about?
I agree.
Like,
and the purpose of that is to start to bridge the gap, because we do have so much separation. But we're, again, when we think about mental health, I'm not taking away the realities of privilege and power and, race. Those things absolutely impact the way we move through the world, but they're also social constructs. Like, we created them.
Yeah.
And then we fall into them. And then we oppress people because of these things that aren't inherently real, right? So it's definitely reactive on both ends. But something happens over time where it's like, oh, I can see you now.
Yeah.
I can see humanity now. I can see the ways that we're more similar than dissimilar now.
Yeah. Yeah. It's hard to have those conversations, especially with everything going on with race and equality. And I mean, there's so many layers to it, but that's an interesting way to get the conversation started.
Absolutely. Yeah. I've learned when to have it and when not to at this point.
Yeah, I'm sure.
Yeah. Trial and error, I've learned.
Like, this is not the space or the place to probably talk about this right now.
Totally. Absolutely.
From your experience, though, because whenever we talk about anxiety or depression, it's mostly anxiety and depression.
Yeah.
When we talk about like people's, mental health or past medical history, whichever. It's mostly, from your experience, anxiety and depression. Is it rooted in trauma, or can it be something that kind of just creeps up on you just during life? I guess, just if that makes sense.
So it's another different way of thinking about it. When I think about anxiety, depression, I think of them as symptoms, meaning we're navigating life, but we're also not taught how to navigate our emotions. And we're also not taught how to honor our feeling, and connect to our mind and our body. So what we see is symptoms of that, of the inability to know how to be in relationship with ourselves. So anxiety and depression are not inherently wrong. They're actually great indicators to let you know that something's off, right? So if I'm not like expressing my feelings, if I'm not understanding what I'm feeling, if I'm not talking about it, if I don't have a safe space to be able to talk about it, to even acknowledge what it is and name it, then I start to see the symptom of that.
Right.
It's like, if you go through life, you go a few months and you are eating, but you're not using the bathroom, you're going to have some reactions in your body to that.
Right.
Right. So that's the same thing that happens with our emotional state. We don't know how to clear it out. And so then we see anxiety and depression.
That's interesting, because you're saying like you're starting to, when anxiety and depression are symptoms.
Mm-hmm.
But do you think sometimes people, they don't know, they know something is off, but they don't know how to label it, like anxiety and depression? And furthermore, they don't even know how to use words to describe how they're feeling in the first place, to even let alone anxiety and depression, but just to say, I'm feeling something, but I can't really explain it.
Absolutely. Yeah. I think that is part of what I'm saying is the problem.
Yeah.
That we don't educate people, like we don't see it as a value. So
Okay.
we don't even educate people on how to start to name it. It's like we teach math, we teach, spelling. If you weren't taught those things, you'd be going through life feeling really overwhelmed.
Right.
So we don't know how to name emotions. And I think that's a disservice. And so I think when people come to me, or when I think about my own anxiety, depression, I'm like, makes total sense. This is not to take away from our DNA. And that is also a big component to it too. Like our DNA, our nervous system, how our brains are taking in information. That's a huge piece.
Right.
But a lot of it is like knowing how to be in relationship with your emotions.
And then once you get in relationship with your emotions, what's what's like the next step? Because after you get in relationship with your emotions, I feel like there's like anxiety and depression about like the anxiety and depression. Like when will I feel better? When will this go away?
Mm,
So what do you say to clients like when they feel that way? Because when you're in the thick of it, even if you're receiving help, it can feel very heavy.
totally, absolutely. I think starting to shift the language, which is there is no point in which you like reach the pinnacle. Being in relationship means it's a constant, like a constant showing up every single day, right?
Yeah.
So it's understanding that one, to your point, we judge ourselves for having the feelings that we have. A
Yes.
lot of times, if we just take the feeling, like I'm feeling sad or I'm feeling unmotivated today, if we just take that and we don't apply any judgment about that, our depression and our anxiety starts to naturally decrease when we can accept what state we're in. But what happens is we judge and we define where we should be. What the hell's wrong with you? You got 5 things you need to do today. You need to clean the house. This is our internal dialogue.
Right.
And so that exacerbates the anxiety and depression.
Totally.
So understanding that part of the process of healing is to accept exactly where you're at. Again, your body, we don't need to do a bunch of cleanses on our bodies because our bodies naturally cleanse itself when we're putting good things in it, when we're moving it. So similarly to our emotional state, we don't have to contort it. I'm feeling sad. Okay, let me thrust myself to happy. How can I be happy? No,
Right.
no, no. Accept that you're sad in this moment. Understand why. And your mind, your emotions will naturally move to where they should move to.
Right.
I may be happy, that may be content, that may be angry, and we
Yeah.
don't need to judge any emotion. And so that process really decreases the symptoms of depression and anxiety. When we accept where we're at emotionally, it's like, oh, I'm not feeling as irritable. It's not as hard for me to get out of the bed because I don't feel like if I do stay in the bed, I don't feel like there's anything wrong with that.
Right. So you're saying you need to just feel your feelings. You need to feel them.
Totally.
Definitely. That makes
Totally.
sense.
Yeah.
Yeah, it's like that's good advice if you are the one experiencing whatever you're going through in life. And I think it's hard when I know I had to learn this through friendships. It's like sometimes when people call you and they tell you they're feeling that way, you want to like fix them in the moment
Yeah. Right.
instead of just sitting with them in their emotions. And then um I was doing that with a friend on like multiple times. They were calling me and I wanted to like make them feel better. And then eventually my husband was just like, I think when they call you sometimes they're not really looking for advice. They're just looking to kind of talk to you. Because it's
Totally.
like, well, I'm telling them they should do this and I think they should do that. And I feel like I'm giving them good advice. And he's like, well, they probably didn't call you for advice. They probably just called you to kind of just be in the space of whatever they're feeling. Yeah.
Absolutely. Yeah,
Yeah.
that's wise words for
Yeah.
sure. Mhm.
Yeah. So
Yeah,
I was like,
it takes
okay.
time to shift that. I mean, it takes some time to know how to just sit in an emotion,
Yeah.
um, especially when it doesn't feel good. So, and then to sit with other people when you know that they're feeling something that doesn't feel good, it's hard, you know?
Yeah. How do you create like a safe space for someone? Because I think sometimes when people may call you, which it's I feel like it's a privilege and an honor for someone to call you in their time of crisis because they're not just going to call anybody probably. But also it's kind of maybe it can make the person who's being the support system feel kind of like anxious or nervous, like am I doing this right? Like how do you create that safe space for that person?
Totally. I think the best way that reduces stress and anxiety on the person who's trying to be support is to just ask what the person needs. They may not know, but like when we do so much work trying to figure it out, like we start to burn ourselves out.
Yes.
We start to feel overwhelmed. And so, to not one word I talk a lot about is over functioning in relationships. And that looks like instead of me going to the person and say, what do you need from me? I try to rack my brain and figure it out and make all these assumptions and maybe I get it right, but maybe I don't. And so an over functioning looks like you got a pie and a relationship is comprised of 100% of the pie. And over functioning looks like you're consuming 80. You're like doing all this work and all, let me, and here's some resources and here's advice. And
Yeah.
we learn about this as clinicians so that we don't start to do that. You don't want to work harder than you allow space for the client. So if I'm consuming 80%, what that only leaves space for is the other person to consume 20.
Got it.
Right. And
Yeah.
so if you are support, and if someone's reaching out to you, allow them space to figure it out. Ask them what they need. And if they don't know, say, okay, that's okay. When you figure it out, let me know. And I'm not going to stop asking you what you need from me because I don't want to make an assumption,
Right.
you know?
Right. And then, yeah, make the problem either worse or just agitate them more.
Exactly.
Totally. Whenever you're going through things, though, whatever it is, things that you have to do to survive, growing up in a certain neighborhood or being in a certain school or a certain job, or maybe you feel like an outcast, out of place, just whatever it is.
Yeah.
Um, Sometimes you have to do things to survive. You
Yeah.
have to do things to survive, and you have to do things to get you through to the next day.
I agree.
You're you're not happy about the environment that you're in, whatever that environment is, or relationship, whatever. Um, but you're also not happy about the things that you have to do to survive that relationship or environment. Um, and it creates a lot of guilt and shame around what you had to do. You had to do what you had to do. But I want to know if you can talk about how to deal with that, how to give yourself space, but then also once you're out of those environments, how probably the things that you had to do to survive can be hurtful to yourself or
Mm,
harmful to yourself once you're out of those
totally.
spaces.
Yeah. Ooh, yeah, that is a really important topic, uh, because I So I think of them as tools in your toolbox. And in a really toxic environment, a really chaotic environment, disassociating might be the tool that you use. Like if I'm in an abusive relationship, I may have to segregate myself mentally from my reality in order to just, like you said, move through the day.
Right.
And that in a really abusive, chaotic, destabilizing environment, I I never want to take away people's coping skills if I don't know the context in which they're needing them. Right? I'm never going to suggest disassociation is inherently wrong if I don't know where they're at in life, because context matters. So disassociation, chaotic environment, okay. That's probably like a really good coping skill to preserve your mind. Now you've started to move away from the relationship that's abusive, or maybe it's your parents. You've gotten older and you've moved out the house. Now you have more stability. Now you have a little bit more safety, or a little bit more power in creating your safety. Now we look at disassociation and it's almost moot. You no longer need it anymore. You don't need to disconnect from your environment because your environment is loving. You don't want to disassociate from your relationships because now you have a great partner or you have really good friendships. So it's important. This is a hard thing to do because this requires some level of self awareness. If you don't have a friend, I always suggest getting in therapy to do this process. Start to evaluate your coping skills, and that should be on a regular basis. Like every year you need to be evaluating, does this coping skill serve me anymore? Is it still giving me what I need it to give me? And you typically know whether it is or not based upon how, again, the symptoms. You got a laundry list of symptoms. You got depression, anxiety. Are all your relationships kind of like in shambles? You're not feeling supported. They're telling you that you're not present. Those are indicators that something needs to shift about the way you're moving through life. you know
Yeah, that
um
can be tough.
it can be, and I always say that's why I say a tool in your toolbox, because I don't think you should ever let go of disassociation. I think you should just know when to utilize it.
Mm.
When to utilize which tool. If I want to nail a nail in the wall, I'm not going to use a wrench. I'm going to use a hammer.
Right.
Right. But that's what happens is we typically we got one tool and we use it for everything.
Yeah.
Got a wrench, I'm trying to use it to open the door. I take my wrench just all around to every single situation. It's like, that doesn't apply here.
Right. Right.
Right.
Like, yeah, we got to use something else.
Right.
We got to use something else. I feel like that. Yeah, that's true. That's so hard. It's so hard to do. But yeah, you're saying
Mhm.
evaluate it every year.
Yeah.
Every
Yeah.
year.
On some type of regular basis. Like what is this still working? Does this still work for me? And then being honest about if it is. If it's not, then again, try to figure out how you can gain more tools in your toolbox. They're probably going to be a little harder because you're not familiar with them, but every learning experience is going to have its curve point, and then it'll get easier over time.
Yeah. Yeah. That's true. It's hard to give yourself grace. I
Mm.
feel like in these moments or whenever you're going through whatever you're going through, because like how you said, when people don't know what you're going through, they see you doing things and then they judge you. And
Okay.
then they're like, ugh, she's like, she doesn't
Mm.
pay attention to me. She doesn't listen, or he is always just like out to lunch or, whatever. They say whatever they say.
Oh,
But just not knowing that's something that this person has had to do for so long. So,
Absolutely.
and then
Yeah,
they're just not giving you grace. So then it's hard to like give yourself grace when probably a lot of people around you aren't.
I agree. I based Alloy's mission and foundation on systemic thinking, because I think that that idea of adding in context, shifting the conversation from what's wrong with you to what happened to you,
Yes.
so important as a culture, as a society, to know how to be able to naturally, inherently look at someone. You see someone and they're displaying a behavior that you don't understand or seems abnormal to you,
Yeah.
and you, whether you have the ability to understand systemic thinking, you can look at that person and say, oh wow, okay, they probably had some stuff happening for, in their lives that would contribute to this, versus ugh, right? The
Right.
first reaction being judgment. Judgment is again a symptom of ignorance,
Yeah.
symptom of our fear.
Right.
But when we can understand and we can again see, like, oh, they're not that much different from me.
Right.
They just have a different circumstance, which would suggest they have a different behavior.
Right.
Then we stop being so judgmental. We can put that tool of judgment on the shelf. We don't have to use that for every situation,
Yeah.
you know?
Yeah. That's interesting you said that. I'm actually in the middle of reading um What Happened to You
Oh, okay.
by Oprah Winfrey and Dr. Bruce Perry. And they talk about that, how
Mhm.
you know, it's always what's wrong with you instead of what happened to you.
Oh,
Because, yeah, if you are encountering people who are behaving a certain way, like no one wants to wake up and like just not be present with anyone,
right.
right? Like
Absolutely.
that's just not normal. So if you see someone or, you work with someone or you're in a relationship with someone and they're just never present with you, that's something probably happened. That's not normal.
Exactly.
But yeah, it's that's interesting. Yeah, I have to take breaks from reading this book because it's like it's so
It's
much.
intense.
It's
It's a lot.
intense. Yeah. I was like,
It's a lot, but it is. I am so happy she took some time to write that book, especially with someone who is also a trained professional, because I
definitely.
think um, Oprah has wherever you stand on Oprah, because I know some people love her, some people don't, but
Hmm.
she has had a story.
She
Okay,
she has a story. She
she
does.
has story,
Yes.
and what I love is that I love when people don't fit neatly into what we think boxes should look like. So, where Oprah comes from and what she has been through
Yeah.
is not how people think of her.
Yes.
And so, she is in a wonderful position to do the systemic thinking, because people can say, "Oh, you were raped and you grew up in this family where like you had all this trauma and yet you're here." So then people say, huh,
Right.
this is an outlier here, so let's look at this.
Yes.
And I love that she talks openly about her process, because I think those are the people who can start to make the bridge the gap.
Definitely. Definitely. We definitely need that. You're bridging the gap too.
I'm trying.
Yeah. So that's great.
Right. That's my family be like, Audra, why the hell do you keep talking? Like you talk too much about your personal life, what you've been through. I always talk about, like, I've been in an abusive relationship, like I've had this, I had suicidal ideation, like, because I want people to understand, don't just assume and look at me and think that my life has been a certain way,
Right.
and you don't, and then project that onto other people. So and because people are always like, I would never think. Well, let's start thinking,
Yes.
you know,
Yeah, let's
start
start.
thinking that
Yeah.
everyone, just based upon, like, if I walk in a room, you're not going to see my trauma, but so let's start thinking, oh, people go through things, even if they may not look like it, or or people who look like they've been through something still are humans. So let's start thinking of that.
Yes. And I feel like it's also important to understand that two people can have experienced the same exact thing, but that doesn't mean they're going to respond or cope with it the same way.
Oh,
You know, I feel like that's something important to understand too. It's like, well, this person went through this, but we can't expect the next person to respond the same way. We can't just, make a blanketed appropriate response to trauma.
I agree.
Yeah.
Fully.
Yeah. I don't have a name for this section yet, but I don't have a name, but to get to know our guests better, I want to ask some questions just to pick your brain. Hold on, here they are. I don't even know if I'm going to name this section yet, but these are just questions I just like to ask people because I just want to learn more about them. 3 questions. Okay, first one. When is the last time you changed your mind about something or someone?
Oh, that's a really good one. Okay, this is it's not really deep, but I changed my mind recently about oat milk. I went to Miami with my good friend, and she was all on like the oat milk wave, and I was like, oat milk, I don't really know, like, is it like skim milk? I'm a half and half. I love coffee. I put half and half in my coffee, and she told me to try oat milk, and I actually really love it. So that was the last time I think that's the last formative moment where I was like, oh, okay.
Oat milk. Yeah. That's interesting. I tried oat milk once. I mean, it's not bad, but I'm more of an almond milk in my coffee.
You're an almond milk type person?
I like almond milk. Yeah. I'm starting to become, and I can't even say I'm a coffee snob. I can't say it because honestly, I don't know that much about coffee. I'm starting to get more into coffee. Gotcha. Yeah. So I'm like real picky about my coffee now, which I never thought I would be because I didn't drink caffeine for the majority of my life. But now that I work night shift, after I started working night shift for about I think I've been working it for almost 10 years now. Almost 10. Yeah. So the first probably 4 or 5, I didn't drink caffeine. And then like that 5th or 6th year, I'm like, all right, I need some caffeine now because
you didn't need caffeine? Like, that's amazing.
Yeah, I mean, like I would drink soda here and there, but I wasn't a person like I need my like cup of coffee today.
Okay.
But now I am.
It's like a thing for me. It's like the act of like the smell, the making it, the like, just having it, sipping it. It's a whole thing. It's like a self-care thing for me.
I get it.
Yeah.
No, I totally get it because I'm getting to that point as well.
Okay.
I totally get it. When is the last time you felt extremely uncomfortable or awkward, and how did you manage the situation or get through it?
That's a good question too. I feel awkward all the time. Probably the last moment that sticks out. My husband and I are becoming friends with this couple that we think are awesome, and like they just exude confidence and like love and fabulousness. So like I think I'm a little awkward around them because I'm always like, they're so amazing, they're so fabulous. And they recently invited us over, and we walk in, and I'm like, what do I do with my hands? What, did I bring the right thing? Like, I brought wine. I'm like, my wine is enough to part, so like I think that was like the little girl in me that's like, will they like me? Will they be my friend? Comes out in the moments when I make new friendships. So I think that was the last time I felt kind of pretty awkward, like a little girl walking into a space.
I totally get it. It's awkward making friends. I mean, I don't know about you, but it's awkward making friends in your 30s. It's different. It's just different. It's
It is.
awkward.
It is, right. It's very
Yeah.
different. You're like, can we say bestie? Like, are we, how often should I reach out to you? I don't want to be too, it's just, it brings out all of your insecurities just right,
Oh
all
yeah,
of.
totally. Last question. When is the last time you either got something right or got something wrong, but you feel like you learned a lesson?
Um, let's see. Got something right or wrong. So, I think I got something. I I don't usually use right or wrong. So I think I learned something from a process of noticing with one of my clients that I had become uh, oh, I was over functioning, and I had an investment in a relationship that was a lot about the relationship with my client, but also about my own stuff and my own family stuff, and recognizing that I was holding a goal for my client that was more so my goal for them versus their goal for themselves. And like starting, and again, that's why I say you can start to feel it, because it's like this, come, like this push. Life, I try to live my life like this, like a flow.
Yeah,
When I feel this, I typically know I'm not moving towards it in the way that I should for me.
got it.
So in pulling back and evaluating, I realized like, oh, I am projecting my own expectations onto this person because I like really value this person, and I really want them to succeed, but like in the ways that I think that they can, not the ways that they need to, in the ways that leave space for their process. So I apologized. I went and apologized to that client, and it was really helpful to just own that and acknowledge that, and I think like open up the space again, for it to be whatever they needed it to be.
Yeah, that's
So
wonderful.
clinician, if you don't have a therapist who can say sorry or like admit that they're wrong, like, you know that's a
Yeah,
that's a conversation to be had.
totally. Saying sorry is hard.
It used to be for me, because I thought it was an indictment on like my entire being.
Yeah,
But when I disconnected myself from like what I do is not who I am, what behaviors I display is not who I am, it released it, because I'm like, oh, I can, I do things all the time that are hurtful to people, not my intention, but it's a reality. So like I say, I take accountability versus responsibility.
definitely. That's important.
Yeah.
That's something, yeah, I think we all can practice for sure.
Right.
I definitely am trying to practice that right now.
Totally, totally.
Yeah.
Yeah.
Thank you so much for coming on. It's always nice having you on.
Yeah,
Always
this was
take something
good.
away.
You have some really good questions, so you're doing an awesome job.
Thank you. I'm dealing with professionals. So I gotta come correct. I can't be on here
I
with
love it.
the nonsense.
I'm like, your questions are so informed. I love that.
Great. I
Yeah,
appreciate that. That means a lot coming from someone with as much experience as you. So,
thank you. Thank you.
all right. Well, as always, I'm inviting you back. So please come back.
Sounds good.
All right. Take care.
Bye.
Bye. Hey everyone, thanks for joining us. You can catch us every other Friday if you enjoyed our content. If you're watching, you can catch us on our YouTube page at On Our Days Off. If you're listening, you can catch us on listening platforms such as Amazon Music, Spotify, Apple Podcasts, and Google Podcasts.